What's up, guys? Welcome to another episode of What the Vet. I'm excited about this because I get to get hype. So, Joyce brought up a very good topic the other day is about this, and she didn't word it this way, but I'm gonna, about the stupid shit clients say to us.
Sorry, Grandma.
Yeah, it's okay. Grandma dropped the F-bomb this weekend, so I got some credit. I'm gonna just tell you, she was making an eggplant Parmesan bro from scratch. It was beautiful, absolutely beautiful. She put it in the oven, right? And she took the foil off of it and went to take it out. And she looked at me, and we're both in the kitchen in our jammies, right, cooking Christmas dinner for the family. And she looks at me and she went, "Fucking perfection." Anyway,
Get it, Grandma. Get it, Grandma.
get it. I'm super excited about this because like the stupid shit is said on a daily, bro, on a daily, and we've had some super awesome comments contributed, to the conversation, and I actually, like, before the episode tonight, looked up on Chat GPT mean things clients say to staff, and they had a lot to say.
Well, and the thing is, it's like on devil's advocate, right? Like we're gonna just throw out they don't know better, right? And you're gonna on some of these that we're gonna read, you're gonna be like, well, they don't. We're just gonna, and it's just a small percentage. But on the other hand, you get the point where you're like the audacity of the Karens and the Kens. And it's in both like human medicine, veterinary medicine. It's on both sides because like I hear it on the human side, right? And one of my favorite things now to say, and I say it with such a tone because I'm sassy and I can't help it, is like, my mama needs a Diet Pepsi. Well, sir, let's start with who your mama is and what room they're in. How am I supposed to know who your mama is? How am I supposed to know?
And why is she hospitalized? Is she allowed to have a Diet Pepsi?
Well, then I gotta look and do all that kind of stuff. But like, it's on the daily where it's both on the phone and in person where I'm like, let's start with who your mama is. I don't know who your mama is. I don't know who you are. We have 37 patients on this floor. I don't know. But it's just, I got on a tangent because it's just people make me go, Allie Dog's making a fort, and she's very excited about it right now. So we're going to do one of the first comments. And Amber, this is the one of them that you commented on. The meds worked, so I stopped it. Go for it, Amber.
Listen, okay, if you have a pet with a chronic condition that requires medication, right? Let's go back to what I commented about a seizure patient. Do you know how many people that I have had tell me that they have stopped their phenobarbital, their potassium bromide, or their Keppra because their dog no longer has seizures? Do you know it doesn't have seizures? The medication is controlling it. Oh, I thought it was just like you just give it until they stop having them and then you can stop it. No, this has been explained to you at length. Don't stop the medication.
And I have never once heard from someone who's inexperienced as a veterinary assistant, veterinary technician, etc., ever say, you can stop this medication. I've never once heard it. And I've worked in some shady places. Not once. It's just one of those things where you're just like, yeah, you don't stop the seizure meds. I'm going to throw in that this is not, well, I didn't know category, that it's not in this category, because hand in hand, seizures, meds, together. You just didn't want to pay the prices. Moving on.
Yeah, he's not having seizures anymore, so I stopped his medication. Well, what's happening now since you stopped his medication? He's having seizures, so the medicine didn't work. It only works when you give it to him. Just saying.
And in some cases are so bad that if like it's every 8 hours, if you are off on that 8-hour mark, it will throw them into some form of a seizure. I've seen that too. Like they have to be on a schedule and set alarms off and everything like that. And if they don't, their pet goes into a seizure.
Yeah. And going along with that, a client told me the other day, I'm talking to them. She came in, dude, in an uproar. And when that happens, my staff knows that I'm an asshole. One. So they came to the back and they get me. They're like, can you talk to this lady? They were upregulated. Girl was sweating. Her cheeks were flushed. Can you talk to her? And I was like, yeah, I could talk to her. So I go up front and she tells me that she came in several months ago for us to examine her cat and we didn't fix it. What do you mean we didn't fix it? Well, she's losing weight and her breath smells horrible and this is happening and that's happening. Mind you, this has probably been going on for several weeks since the visit. But now it's an emergency and she walked in expecting it to be seen. Err on the side of the patient. I'm going to get you seen. Err on the side of your attitude. You can fuck all the way off. But anyway, all right. So I put him in the exam room and I took the case. I said, listen, what's going on with your cat? Well, she came in for an oral exam because her something was wrong with her tooth, and her breath she had some pretty nasty halitosis going on. I'm like, all right, cool. I said, so I'm looking back here in your history, and when you brought her in and said we didn't help her, or didn't do anything for her, we ran full panel lab work on her, and she was diagnosed with hyperthyroidism, and she's continuing to drop weight. When is the last dose of medication she had? We gave it to her for a week, and then we stopped giving it to her because it wasn't working. And we've not seen her since. No. And she's getting so skinny, and I'm like, okay. So I
For the
documented.
people that don't know, that you're not going to see improvement on this condition after a week of medication for a hyperthyroid cat. They will continue to lose weight. They have to be on medications for a good chunk of time before you're going to see them start to gain weight. But carry on, Amber.
So everything in white, I made them custom discharge documents about hyperthyroidism and weight loss and feline dental disease. And I copied all of those communications in the chart. So she cannot come back and say, we didn't help her cat. We didn't tell her this. We didn't tell her that. Like, she was screaming in the lobby. And her husband, actually, when I went into the room with him, apologized to me for her behavior. And then told me, yeah, we stopped the medication because it wasn't working.
Like, it needs like a good month for it to even start touching if they're depending on the severity of the disease, right?
Yeah.
So borderline, no, you'll see improvement quicker. But if it's like strong hyperthyroid in their levels, it's going to take a hot second because that level took a hot second to get there.
Yeah.
Okay.
So what you got?
My pet has been sick for a week and it's 10 minutes before you close. But can you squeeze me in? It's the squeeze me in because you're 10 minutes before you close. It's the squeeze me in part.
Squeeze, yeah.
That has happened so many times, even on emergency side. You are 15 minutes till closing and in walks Fluffy. And you're like, this bitch. It is 7:45 and we close at 8. But okay, we have everything clean, mopped, all the animals discharged. Fluffy comes in and they need a full gambit of blood work, x-rays, everything.
Not to say that we don't want to see emergency. If it's a genuine, an acute emergency, and that's something you've been watching for 3 days, and you decide to bring it in, 15 minutes to close, 10 minutes to close. Get out of here.
And 9 times out of 10, from my experience on emergency side, that pet could have walked into their day practice just as equal, and they were not on death's door. Only on probably about 10% of the cases that needed to be seen were true emergent cases, and we were there until like 11 or 12 p.m. working on the case, not caring because that's what the pet needed, and the pet couldn't transport to another facility, but 10% of that cases in emergency. This was a good one. I don't need diagnostics or exam. My pet just needs antibiotics all the time.
Treating.
At least once a week. We just like, I can't tell you how many practices has a magic 8-ball as like a gag, and we just shake it. Like, all right, what's wrong with Fluffy today?
Exactly. Or the magic wand that stays on the shelf in the office. You just break it out when you need it. Just need antibiotics. And what target antibiotics would you like to use? Fluoroquinolone? What are we looking at here? And they look at you like, my point exactly.
So this is like my friend's hairdresser's accountant's sister's brother's mother is a nurse, and they said, which goes into, well, I'm a nurse. So those two kind of go together. And I'm going to exclude, because a couple of people put in nurse/human doctor. Every human doctor that I have encountered was not bad. It was the human nurses that were more difficult to work with. And we can leave that one for another day. But, we've talked about that in the past. You're only in it for the money, and you're just going to let my pet die.
Several. We all have. But again, I'm the asshole. I'd like to hear your response to one of those insults. Yeah.
Oh, I was like, I'm here like in my own little world going through the comments. Hey. So my comeback is a little bit more politically correct than Amber's, because I've heard her come back on a couple of the emergency side ones, is I'm like, well, humans have, for the most part, health insurance. And then they just stare at me and I go, correct? And they're like, yes. And I'm like, okay, so that pays for part of your bill. And they're like, yeah. And I'm like, okay, how much was that bill for your stay before insurance? And they're like, I don't know. And I was like, you were looking anywhere from like 20,000 to 100,000, and you now only have to pay 2 to 3,000 of that bill. And they just stare at me, and I'm like, do you have insurance on Fluffy? No. I'm like, okay. So these are the costs of X, Y, and Z. We only mark up X amount. So I break it down to them because I don't care. I know what the markup is generally for the practice that I am working at, and they're pretty open. And I make a point at saying how much of a difference it is between veterinary and human side. Sometimes it does not work and they do not care and they still think that we were in it for the money. God forbid you spend all your money on Christmas gifts and your dog decides to eat a foreign body and needs foreign body surgery. That is around 10 grand.
And it's our fault.
That's our fault, and we destroyed Christmas. We did not. We did it. I have literally had parents with their children in the room look at me and said, well, she's the Grinch. She's why we can't have Christmas, because I asked them to sign the estimate and leave a deposit. I took the high road on that one, but like, and the kids were just like, and I'm like, and they're like, and we don't want Fluffy to die. And I'm like, they ate your things.
Right.
I didn't make Fluffy eat anything.
First of all, it's not my fault that your dog ate your daddy's mistress's thong. That's not my problem.
I had that happen before too.
You know what I mean? That's what I want to tell these children, these little crotch goblins. Listen, it's my fault that you're not getting a bike for Christmas because your daddy's a hoe. You know what I mean? But you can't say those things. You can't. You want
you can't, to. Goblin. So it goes along the line of the hyperthyroid one that you mentioned. I stopped giving my cat their blood pressure medications because they were acting normal again.
Please don't do that.
Please don't do that. It's just how we have to take our own blood pressure medications to keep our blood pressure normal.
He's acting normal because he's on blood pressure medication.
1 + 1 still equals 2.
Yes, sometimes.
It's not my dog. It's my kid's dog, and the kid is 8.
Your fucking dog, bro.
Oh my god, I had this one, and I had waited. I can't tell you how many years I had waited for a human to tell me this at a vet clinic. I live in a gated community, so I don't need heartworm prevention because mosquitoes don't come in. I had that happen once, and I was giddy with excitement. Gated communities do not have force fields to keep bugs and insects out.
I've had that one, and I have chain link fence. I don't need heartworm prevention.
Mm-hmm.
Okay. You do you, boo.
I've had this countless times, and we will throw in, I looked it up on Google/ChatGPT. And what do you mean it's wrong? Now, for ChatGPT to work, because I'm just as guilty as using ChatGPT for all parts of my life, hi, Ellie, you have to give the correct data that's going on, as in not what you think is going on. That's a key point. You can say, Fluffy is acting like this, but really, a vet tech will see it acting differently. So what you put in for that, ChatGPT is going to tell you what it thinks it could be.
Yeah.
But that doesn't mean that that's what's actually going on with this thing. You know, you're giving the pet owner's description, not the veterinarian's description of what's going on. And it's a lot of times two very different things.
Mm-hmm.
We're going to notice more subtle things versus your dog ate a ham bone. Which is the next comment. You didn't tell ChatGPT that your pet ate a ham bone and now it has raging necrotizing pancreatitis. Why is that?
Exactly. Or you Google the symptoms and its pet has a urinary tract infection and he comes in and all of his mucous membranes are the color of a highlighter.
Mm-hmm.
Definitely not a urinary tract infection.
Yeah.
These platforms are cool for you to somewhat educate yourself on things, but at the same time, they don't have their eyes and their hands on your pet. They don't know what our pulses look like. They don't know what our respirations look like, what our chest sounds like, what our mucous membranes look like. They don't have that pertinent data to make a diagnosis. Or blood work or x-rays or anything like that. Like you can throw in some general symptoms. Vomiting and diarrhea, right, can mean 900
number of things. Yeah.
So
you tell them no food or water after midnight, and they said that they were hungry, thirsty, so they gave them just a little bit. Then post-surgery, they vomit, and they get a nausea injection charge. And then they get mad at check. Cerenia injection is not cheap, people, but it is an amazing medication, and you're lucky that your pet didn't aspirate and now have pneumonia.
So either you cancel and reschedule your surgery, or you take the Cerenia injection.
Mm-hmm.
Those are
Oh, there you go. So I had this one happen before. And it's sad that as we read these comments, we say, we've had this happen before to not just one, but all of them. We need to euthanize today. She has been sick for a while, but we are going on vacation and we don't have anybody to look after them. You're not wrong. Fluffy does need to be euthanized. So we are going to, but we hate that it's to help your life because you had this pet suffer.
Convenience euthanasia.
Convenience euthanasia. Okay. So this was a nice little story. We had a house call vet comment that said someone was expecting me to euthanize their German Shepherd that has already bitten the owner, but they can't put a leash or a muzzle on the dog. They expected me to dart the dog to get it sleepy. She's like, that is not what we do. And she is correct. We don't carry around darts and special needles to go in said dart to.
No.
I've worked with one vet that actually had that, and that's because they actually did wildlife on the side.
Yeah.
We don't do that.
No.
And this is another little story.
Not us.
Yeah, this is another little story that has sadly happened. It's not necessarily what they said, but an animal I about screamed like a little girl. Sorry. This moved on my hand and I thought it was a bug and you about heard a girlish scream come out. Anywho. Okay, so not necessarily what they said, but an animal comes in unresponsive and you see a bandage wrapped around the abdomen, but the smell hits you before you can see what is unconscious. Odds are it is a spay gone bad or some surgery gone bad, and it's now having pus literally drained from the abdomen. I have seen that, and thankfully on 2 cases where literally they gently push on the abdomen on said dog that had a bandage wrapped up and pus came draining from the abdomen on 2 cases. And it wasn't like and to the owner's credit, they were doing everything that the vet was saying and did. The only reasons those dogs made it is because of their owners and the pet's will. Both of them should have died because they had multiple surgeries over a week and stay in critical condition. And I will never forget those 2 dogs. One was a Bouvier de Flandres, and then the other one was a Labrador that liked to eat rocks. And both had pus pouring from the abdomen. And I'm not just saying like a couple of drops, guys. You gently, I'm gently push on the abdomen, and a river would come out through the incisions. Both of those cases were the most crazy cases I've ever worked on. And then the talent of the surgeon and internist that worked on both of those cases. Chef's kiss on that because they're the whew.
Damn.
When you take the pet back to treatment and they say good luck.
Accepted.
Honestly, yeah. But here, as someone that was a client recently that had to euthanize my Shih Tzu, I literally handed over the Shih Tzu and said, when you put in the catheter, I am warning you, he will bite. So I gave all the warnings and then they gave him back to me and they're like, he was an angel. And I'm like, motherfucker. But the last time we tried to draw blood from him, he was like, oh, fucking Cujo. Okay, so I think we are ready for the one that won the award. ER Vet Tech here. A guy came in that confirmed rattlesnake bite. Okay. Given the estimate for the treatment, people, antivenin alone, thousands of dollars because you need multiple vials. And sometimes hard to get because you typically have to physically drive to a human hospital, grab the vials, drive back, administer it. So after giving the estimate, I'll just take him home and give him milk to neutralize the venom. Sir, it doesn't work that way.
Give him milk to neutralize the venom. And I'm very big on venom research and the venomous snakes because dealt with them very much in childhood. Milk. Now, is that 2%? It is better. It was whole milk, 2%, soy milk, oat milk, you know what I'm saying? Almond,
I don't know if there's data to confirm which level of milk would be the most effective. I think he has it confused with Bofu toads, where if a dog bites it, we will rinse the mouth out with milk, but they still need treatment for the poison. It's just to help with the hypersalivation and things like that.
Yeah. Milk. Okay. Yeah.
And I did write that. I wanted to be like, my question is, did he actually take the pet home?
And give it milk. I want to know.
And give it. I'm gonna reply just to ask.
Or
question
dead at this this animal went through as this venom ran, like coursed through its veins and shut its organs down and caused all kind of weird shit to happen. Like, I want to know. Like, and I think in those instances, that's when you call animal control out for a wellness check, because that animal probably had a very horrible death.
Well,
If
and
you're not,
and that's the thing. Like, I've called animal control to do wellness checks before on people that have taken their pets home against medical advice that were truly, truly sick. And it's not, and it is a little judgy because, like, we don't know an owner's finances. We don't have access to their bank accounts in any way, shape, or form. So you are judging by the appearance if they can or cannot afford, right?
A lot of the
Anything.
time.
And like, and I'm not saying that I have worked with vets that will literally give the shirt off their back to help a pet that's truly in need, right? Like, we will give paper scripts. We will do anything that we possibly can to give some form of help to the pet. And we have called wellness exams on people that, given by what they drive, appearances, etc., have, jewelry that they have on. Granted, they could all be in debt because of that. And they were still refused because they didn't want to spend money on the cat or the dog. And it wasn't, and you can tell after a while of really working with people and money that if it's a I can't versus I don't want to. And it gets down to even like how they present it, their facial express, like everything. Like, you just know for the most part. And I'm not saying that we need them to drop $10,000. We don't expect that. $150 for even the exam, emergency fee and exam, but they don't want to.
Yeah, like, I'm not paying that. Yeah,
And
I've had that. I'm for euthanasia. Be like, oh, I'm not paying that. I'll take it home and put a 22 bullet in his head and dig a hole.
had that before too. Yep, I'm not paying that amount.
Bro, like, why?
Yeah, why'd you come in?
Yeah, you know what I mean? It's just ridiculous, the shit that people say and come up with. And like, our jobs are already hard. Those of you that are pet parents and are listening, just mind your P's and Q's and watch what you say to us. You're gonna catch one of us on the wrong day, to let you know all about yourself, and not so professional.
I do want to point out, so picture something like this, but younger, like puppy face, right? So yeah, thank you, Allie Dog. This is really one of this. This was something that has stuck with me for probably 12 years. And the dog may or may not be alive still because it was a Dachshund, okay? So you have the breed in your head, right? Well, Dachshund thing. This is not a Dachshund thing, it's a Terrier thing. But size is relevant. A gentleman brought it in to have sutures removed, right? All right, thank you, Allie Dog. Thank you for being a demonstration. And I was loving on it because it was a Dachshund puppy. Do you know what that gentleman told me? Stop giving it love. I don't want it to be nice to people. I want it to guard the house. Rage. So instead of appropriately training your dog to be a model citizen at the vet, it can still be a guard dog at your house. But when you take it into the outside environment, it should have manners. It's not an appropriate dog to be a guard dog. I swiped that dog off the exam table so fast and said, we'll remove the sutures in the back, and gave that dog so much love. We all carried around, and it was just a wiggle worms, and it was just the cutest little thing in the whole entire world. And I've never, honestly, that stuck with me the most because the way he said it to me was also aggressive. And I was like, this bitch. I was mad. It was like, I look good in orange. For this dog, I will look good in orange.
Yep. Or white. Put me on death row. I don't care.
And I did. I put that dog I carried that dog to the back. We had that dog in the back for a half an hour giving it love.
Yep.
And it was eating it up. We gave it treats, the whole 9 yards. And sutures were fine. Like, he did take care of like the incision and everything like that. Like, that's fine. And finished the medications, blah, blah, blah. Yay for that guy. And I'm like, and that was like, I mean, other ones obviously have sticked with me, but for some reason, that one hurt my soul for the dog.
Yeah.
Like, for the dog, that one hurt my soul.
Yeah.
And he wasn't getting rid of the puppy. He wanted to keep the puppy because he thought it would make a great guard dog for some reason because it's a dachshund.
Listen, somebody would come all up the house. They're not going to be afraid of your dachshund. They're going to punt that little thing like a field goal. Teeth and all. Like, just throwing it out there. That's not a guard dog.
Like, and we had the cops recently at the house. Amber knows why. It's a very hysterical story. But the cops saw the cage of the dog. The cage. So, like, it is a pretty much the size that would fit a Great Dane, right? But it's for Belgian Malinois. For people that know Belgian Malinois, they're svelte. You know, they're not overly big, but like, you know, they can be a really good guard dog. And anytime I mention like, hey, I'm just going to make sure the dog doesn't come out of the bedroom because he will bite. You are an unknown person in his house. And he's like, the cops was literally said, I saw the size of the cage, you all on your own, and shut the door on 3 cops. So again, he's not that big of a dog compared to like Allie Dog, who actually out of all 3 dogs would do the most damage if someone was breaking into a house. But I digress on that.
Too funny. Too funny. Yeah. The things that get said to us on a daily basis. Like I keep saying this, pet owners, dude, if you're watching, just mind your P's and Q's and don't be jerks when you come in and say the most off the wall things, accusing us of being heartless and in this for the money. First of all, if you're going to come at me for being in this for money, this is not a car dealership. We don't work for
No, we don't.
We get our meager hourly wage, whether you sign that estimate or not. We're coming in the best interest of your pet. Unfortunately, veterinary medicine does not have the support of big insurance companies, so therefore we have bills to pay. All the products that you want us to send out the door for you for free, we have to pay for those. All of the diagnostics, all of the everything. We have to pay for literally everything in that hospital, right? And then you're going to want to compare our prices to our low-cost clinics, things like that. Do your research. We've had discussions about this before, but before you come in and you berate a technician or a receptionist about just being in this for the money, about us being heartless, or we wouldn't take your pet because we were too busy. Yeah, sometimes we are too busy and we reach something called a capacity for care. Just because we're an animal clinic or an animal hospital does not mean we are responsible for every living thing in our area code, and we reach a capacity to where we don't have the resources or the staff to adequately care for your pet the way that it needs to be cared for. And rather being money hungry fuckers that you accuse us of, we turf you out somewhere else that has the time, the resources, and the ability to give your pet the care that it needs. And I highly advise you do not walk into one of my clinics talking shit about your wait time and that we have emergencies that we have to see. Be thankful that it's not your pet, bruh. Be thankful that it's not your pet that's being put on a ventilator or admitted to ICU or, God forbid, being sent over the Rainbow Bridge. Like, have some respect. And furthermore, when you go to your hairstylist, right, and she tells you you got split ends, that your hair's a mess, you got gray hair coming out, and she gives you, oh my God, it's going to be $400 to correct your hair. Do you get up out of that chair and berate her or him, whoever does your hair, I'm not sure, and be like, you're just in it for the money? Do you? Granted, I hate to compare getting your hair did, but still, it's a service for you. They have a business to run. They are in it for the money, but do they get the shit that we do because we're supposed to have bigger fluttering hearts because it's the animals that we need to take care of? You took responsibility for that animal, my guy. You did. And you should have did your research, and you should be well aware of what it takes, what it costs to take care of your pet. And stop talking shit to us.
Did you take your blood pressure medication today?
I haven't increased it like I was advised to.
Okay.
So I might be a little high. But I just get passionate about that because it's just the shit that we've had to put up with this week of things that, it's Christmas time and you're really, like you said, you're, causing me not to be able to buy gifts. No, you're causing you not to be able to buy gifts because you decided to feed your fucking dog half of a pizza. I didn't do that. You did that.
That's true.
Or you bought a puppy off of Craigslist that had parvo, my guy. That's not my fault. You did that. Sorry. It just upsets me.
So, yes, if there are any clients watching this, use these examples to learn from, please. It's one thing if you don't actually know what you're doing is wrong. That's fine. Ask us. We don't care. We would gladly tell you to not feed your dog half a pizza or a ham bone. Or let your pet eat underwear.
That belong
common
to your
sense
mistress.
Common sense isn't always so common, but also it's not our fault. It's not our fault.
No, we genuinely get into this because we care about your pet. If we were in it for the money as technicians, I promise you we would not be technicians. We would not be managers. We would not be assistants because there is no money there. There is no financial future for us. There is no financial benefit for half of the field, if not quarters of the field, can't even pay their bills on their salaries. So don't come at them about the money.
We've covered that in previous episodes as well, if you want to go back and watch them.
We do have phenomenal clients that take very good care of us, treat us with respect. We have very good relationships with them. Not even saying it's everybody, but those certain few.
But also notice how often Amber and I said, yeah, we've heard that. We've dealt with that.
And that's just us.
That's just little old us.
So yeah, I
But yeah,
digress.
and until next week, guys, please like, comment, share, do all the things. You know, it honestly, it really helps us. Even if you just like it, it's just the algorithm pushes us out. So if you like
And
this, do it,
hashtag be nice to your
please. With sugar on top.
she.
Just be nice. Just be nice. A little bit, like just a little bit.
Mhm.
Nicer. Let's work on nicer instead of just be nice. Just nicer, because I have issues too. It's okay. We all do.
Me too. Like
Common courtesy.
yeah.
But yeah,
It'd be
until
a
next
very
week, guys.
common courtesy to like, share, and comment. Just saying.
Bye.